The Black Doctors podcast highlights the stories of minority professionals with the goal of inspiring others. Season 2 provides more episodes and features a wider variety of professions. If you like what you hear, please subscribe and share with others, because the next generation can't be what they don't see. Tune in every Monday to hear our stories told by us.
Welcome back to the Black Doctors podcast. I'm Steven, your host. Today we're joined with Doctors Dominic and Shannon Chapman. They're both dentists and they practice in Maryland. Thank you so much for joining us.
Thank you for having us.
Yeah, thanks for having us, Steven.
We've known each other for a while now, 6 years since we left Howard University. You guys were at the School of Dentistry. I was at the School of Medicine. So it's been great to watch each other's careers progress, and I'm so glad we're able to reconnect, even if it's over the phone.
Yeah, absolutely. I mean, especially with what's going on, it's good to have these different mediums that we can catch up. So yeah, absolutely. This is exciting.
So Shannon and Dominic, you guys are both dentists. What do you love about your current practice? Tell us, what is a typical day like for you?
Things that we absolutely love about our practice right now as associates, we don't have to worry about some of the managerial things, the behind the scenes things. We come in, we do our dentistry, we take care of our patients, and then we can go home. A typical day for us starts at 7 a.m. We start seeing patients as soon as we get to the office. We have a half hour for lunch, and then we see patients until 5 o'clock.
That's pretty much it. That's one of the biggest, I think, joys about being an associate dentist is you just kind of show up and you do dentistry, you meet patients, you laugh with the patients, and then you go home. You don't have to worry about, fighting insurance claims or
Payroll
or disciplining staff. Now some associates, they get pretty involved in the office, but because we're working towards building our own thing, we're not really, too involved in our current office that we're working in right now. We just go in there and try to do the best dentistry that we can, and then go home and have some dinner.
And how big is the office how big is the office you're working out of currently? How many dentists and hygienists are there, and chairs even?
So the office we're working in currently has 10 chairs. We have 3 hygienists, and we have 2 doctors on staff per day. Dominic and I work 4 days at the office, and then we're off on Wednesdays. On those days, we have a pediatric dentist come in, and then there's another provider who comes in on Wednesdays.
Yeah, and I'll just add to that a little bit. So we work in kind of a group
DSO.
practice setting. It's called a DSO, which means that there's like multiple offices and multiple locations. So right now they have a total of six offices, and we work out of one.
Okay. So it sounds like it's mostly the 2 of you that work out of there, except for Wednesdays?
Right.
Correct. So we work together as well, which is nice, but it wasn't always like that. Like we worked at the same company, but we worked at different offices at the start. And then the office that Shannon was working at actually burned down, and she ended up starting to work at my office.
Yeah. So what don't you like about your coworkers? I'm just kidding.
How much time we got? No. I don't think you're gonna listen to this podcast.
So as dentists, what exactly do you guys do? Because I know I go in, sometimes the hygienist, I think, clean my teeth, and then you guys come in and like you poke my gums and you poke. What do you guys do?
Yeah, that's pretty much it. No, Joey. we do some more things. Shannon, you want to take this one?
Sure. As general dentists, we do hygiene checks that you were talking about. We also do fillings, crowns, root canals, crown and bridge, dentures, extractions,
implants.
Mm-hmm. Anything that's a little too complicated or advanced for a general dentist, we would refer out to a specialist.
Mm-hmm.
We love our specialists.
Yeah, absolutely. Steve, it's funny you say that because my cousin thinks the same thing. So, I mean, I guess we're kind of less than fortunate not to need a lot of dental work growing up, right?
Mm-hmm.
So my cousin swears that we just kind of walk in and poke around gums and push on your teeth, and then that's it. Like that's all we do. And I think it's funny because like different people have different experiences. And if you're fortunate not to have a lot of dental work done, then that's kind of the perception of what a dentist is. But in reality, you do a good amount of things, full spectrum. As a general dentist, you can do pretty much a full spectrum of services. And then the more complicated things, as Shannon was saying, we'd refer to specialists. So there's a wide range of things you can do. That's why I kind of decided to go the general route, because we can kind of focus on what we like and refer out things we know.
Yeah, I mean, I'm an anesthesiologist, right? So nobody really knows what I do either. I just put people to sleep.
Yeah, I think you guys read books, right? Is that what it
Yeah,
is?
something like that, and hold a chair down. I think my patients, they always
Yeah.
say, "Oh, you get paid to put me to sleep," and I'm like, "Well, I don't
Yeah.
get paid unless you wake up."
There you go. Yeah. No, man, we have mad respect for what you do, because we did oral rotations in residency,
Hmm.
and yeah, man, kudos to you. It just seems like it's so chill, and then a bell will go off, and you guys are like in
Everyone's
warp
springs
speed,
into
hyper
action.
speed, and yeah, I mean, like, I don't know, I couldn't do it, but that's awesome that you do it.
How often should people be going to see you guys?
At minimum, at least twice a year, usually 6 months apart, sometimes a little more often if you have periodontal disease or if you have treatment that needs to be completed.
Yep.
I have never heard that.
Which one? The 6 months?
Yeah, I was lucky. I'm lucky if I go once a year.
Okay, well, surprise.
Yeah,
Yeah,
now
yeah.
we know. You heard it here first.
Yeah.
What else? I gotta get all my questions out for the dentist. And then you guys take X-rays every couple of years.
So we like to have updated X-rays at least once a year, and those would just be routine X-rays. But if there's an acute problem going on or emergency, then we'll take like X-rays as needed throughout the year.
Yeah, and that's part of your current practice. Do you take any sort of call?
Well, if they have an emergency
Yeah,
after hours
yeah,
or
they'll
on the
call.
weekend.
They'll call. Maybe they need an antibiotic called in, but we very rarely have to go into the office like during the weekend or during off hours.
So it is 2020. It's the middle of the summer. The COVID-19 pandemic is upon us. How has that affected your practice?
Yeah. So before it hit, we were seeing news from other countries, like China, and seeing how it was affecting them. And I think we were in a little bit of denial as a company that it was gonna, affect the states the same it was affecting other areas. So things were happening pretty quickly. Like it seemed like every day we were getting updated information of things to do, things not to do. And it was around March. That's when I think our company decided to close down, right? So in March, it may have been like a Monday. We were talking about closing, and then on the Wednesday, we ended up the company ended up closing 3 offices, no, 4 offices.
Mm-hmm.
Yeah, our company closed 4 offices and consolidated like emergency only treatment into 2 offices. And myself and Shannon were working 1 week on, 2 weeks off, just seeing emergencies. And then that lasted for about 2 months.
Right. So there were different providers that were seeing emergencies
Yeah.
every week, and I guess they built in the 2 weeks just in case someone needed to quarantine
Yeah.
so that you could come back to work.
And then we did that for 2 months. We got back to work around, what would you say?
The middle of May.
Middle of May? Yep, got back to work around middle of May. It was interesting though, because even when we were just seeing emergencies, like we thought it was going to slow down, and patients are going to be a little scared to come in because of rightfully so, the uncertainty and everything that was going on. But I mean, if you have dental pain, I mean, you can't really neglect it. You can't run from it. So we were still busy even though we were just seeing emergencies.
Wow.
The reason why the company closed those offices was because they thought that we couldn't control like proper infection control protocols in the smaller offices,
Mhm.
and we'd be able to limit the flow of patients a little bit better in the smaller offices. So a lot of the bigger offices closed, and we had just the smaller ones open.
And then, I guess, was it from the American Dental Association, or like the updated guidelines and how to protect dentists
Y-
and hygienists and staff?
Yeah, so there was some guidelines that came out, and they were basically saying leave a certain amount of time between patients. Don't have more than the don't have excess patients in your office.
Right. So you're
Uh,
only allowed to have 10 people in the office at any given
yeah,
time, including staff, the provider, and patients. So we were
Mm.
asking patients to wait in their cars. They could come in to check in, and then they had to wait outside if they were early.
yeah. And those are the biggest guidelines. The guideline with like waiting a certain amount of time or having proper space between patients, I think that's what really kind of slowed us down. Other than that, like patients were coming in, but we were the ones that were saying, we have to increase the length of appointment times, and we couldn't have more than a certain amount of people in the office.
And the
So
ADA also imposed restrictions on the kind of procedures that we could do. Initially, we were only supposed to be seeing emergencies, and you couldn't provide any kind of procedure or service that would produce aerosols, which is
Mm.
pretty
our
much
entire
everything we
job.
do. Yeah.
You could take x-rays, you could extract teeth, that was, you
Prescribe
could
like
prescribe
antibiotics and stuff like that.
antibiotics, and that was about it.
Wow. Well, I think time will tell as we continue to weather this storm and see what this pandemic brings us. As hot spots are flaring around the country, and some places are cooling off. But
Yeah.
who knows? Fortunately, it sounds like you guys have done okay throughout this pandemic.
Yeah, you can only, try to be as safe as you can. I mean, with our profession, there's inherent risks just naturally, just because of what we do. With aerosols flying around, being exposed to, blood and saliva and all that. So you just take the proper precautions, wear the proper PPE. We feel that now this is like the safest we've ever felt practicing dentistry because of the different things we're wearing now. So we wear like a face visor now, and I've never worn a face visor before. I just have like my loops on and my glasses.
Hmm.
I wear a surgical cap now, so I feel really cool. And then we have
Well, we have the N95.
yeah,
with the
N95,
surgical
which is
mask
like big.
over it. We
Yeah.
have disposable gowns. Yeah.
Good. I'm glad you guys are taking all those precautions.
Yeah.
So, for both of you, when did you first decide to go into dentistry?
I decided to go into dentistry because my younger sister had a lot of dental issues with her front teeth growing up. She had an accident as a baby, and it kind of changed the way that her adult teeth developed. So she's had a lot of issues with her two front teeth, and that got me interested in dentistry. And then also the fact that our family dentist and our orthodontist were Howard graduates, I kind of saw that it was possible for me to be in that position. So I never felt like it wasn't something that was attainable. And I went for it, and it worked out.
And where'd you go to undergrad, Shannon?
I attended the University of Central Florida. Go Knights.
UCF.
Yeah, I forgot. We actually had a mutual friend or two because I was at University of South Florida for a year. I forgot about that.
Sasha.
Yep. So from UCF to Howard Dental.
Yes.
And any struggles or things that you wish you'd known during the application process, or how did that go for you?
I think I
Right.
took my admissions test twice. I didn't like the initial score, and I think that was smart. I don't think if you're not happy with your score, take the test again. If you have to apply the next cycle, I mean, it'll still be waiting there for you if you feel like you'll be a stronger applicant if you take the test again.
And with the dental school admissions test, if you take it twice, are the results combined together or looked at separately? How does that work?
The results are looked at separately.
I don't know 100%. I think they're looked at separately, but I don't know if they see like you've taken it multiple times. I'm not sure.
Well, at least during the interviews that I went on at multiple
Yeah.
schools, no one said anything about the fact that I took the test twice.
There you go.
And then for you, Dominic, when did you first decide to pursue dentistry?
Well, for me, it was when I was a kid as well. Both me and my sister had braces. My sister's teeth were a little more jacked up than mine, and she needed she needed this expander that kind of goes in the roof of your mouth. And there's this key that you use to turn it every like day or every other day to widen your jaw so that the teeth can fit together properly. So, I was a kid, like, I don't know, 6 years old, probably not recommended that you're supposed to do it. But yeah, I would turn the key for her. So I thought it was big stuff back then. And I just always kind of, I just kind of fell in love with the concept of, you know, working on teeth, I guess, which evolved into becoming an orthodontist. And then when I, got to Howard and went through school, I realized that I wanted to be a general dentist and not a specialist.
How old were you when you were working on your sister's teeth?
I must have been young because this is like I was in grade like 6,
So
maybe
you were
5, 6.
11 or 12?
Is that the age you are?
Yeah.
Grade 5 or 6? Okay, I'm terrible at that. Yeah, I was in grade probably 6. Maybe. Yeah.
Wow. And
hmm
then where did you go to college?
I went to the University of Vermont. I played soccer there. I was blessed and fortunate to have a scholarship, so that really helped, financially. Was there for 4 years, and then I took 1 year off. I took a gap year. I'm very proud of my gap year. I brag on my gap year all the time
Hmm.
because it just allowed me to, really figure out what I wanted to do and enjoy my time before I threw everything into dental school. During that year, I, studied for my DAT, which is the admission test, and went through the application process, took some interviews, and eventually ended up being accepted to Howard University College of Dentistry.
Nice. And Shannon and Dom, what were your majors in undergrad?
My major in undergrad was molecular and microbiology. We didn't have a pre-med or pre-dent track. That was the track that everyone studied if you were planning to go to professional school.
For me, it was biological sciences is what I majored in, and I minored in chemistry. And I had no plan B in regards to like if I didn't get into dental school, I had no idea what I was going to do.
So then you guys both started at Howard, or we started at Howard. That was what, summer of 2010?
Yep.
Oh my God. Great memories were formed.
Yeah.
How was your guys' experience at Howard?
I loved Howard. I know a lot of people have different opinions about their experiences, kind of being in this bubble of Black excellence, and you're feeding off of the energy of your classmates or friends that you make in other professional schools within the university. I think iron sharpens iron. You're striving to be better because the person next to you is also Black or brown and they're doing better.
For me, I had a good experience. I had a memorable experience. Going through our program, we always thought that we were being treated hard or being treated unfairly by faculty and stuff like that. But you get out, you talk to other people who have graduated from other schools, and you realize that every program has their challenges and their difficulties. But we appreciate all the lessons that Howard taught us, not just like skills from being a dentist, but like life lessons and how to adapt and make things happen.
Mm-hmm.
Maybe when you don't have all the proper resources.
Yeah, I mean the environment at Howard was so incredible between
Yeah.
the schools of dentistry, pharmacy, obviously the school of medicine. We pretty much shared a building, so
Yeah,
being
absolutely.
able to interact with each other was inspirational and supportive. One of the important things about Howard University College of Dentistry was that your paths converged and you two met each other for the first time, I assume.
Yep, absolutely. First time.
So when exactly did you guys go from like, I don't know, meeting each other to actually hanging out, and where was that
hmm
spark formed?
Yeah. You want to take that one?
Sure.
Okay.
So midway through dental school, this would be the summer of 2012, between our second and third years of dental school, Dominic and I started hanging out first as friends, and then it evolved into a more romantic relationship. I'm trying to word this and not be offensive. I was coming out of a relationship, and I really wasn't looking to get into anything, and he saw a window.
And he climbed right through that window.
I'm a very charming individual.
He is very charming.
Yeah, right. Yeah. No, it was very organic, and it happened like very naturally. There wasn't, any resistance on like either party. It was just very natural, and kind of just happened. We started hanging out more towards the end of our second year in dental school, and then we went up to Caravana in Toronto.
Right.
And that was it. After that,
soca music.
After that, I knew, because I love soca music. So once I found out Shannon was down with like the Caribbean culture, I was like, okay, this is a wrap. It's all good.
Awesome. It's a beautiful, beautiful story. And I'm sure there's so many stories of Howard bringing such amazing couples and people together. You guys are great people, and I'm so happy seeing you two together.
Well, thank you.
Yeah, we're very grateful for Howard. Dental degrees aside, like the biggest thing that I think we both got from Howard was that like we found each other, and we're very grateful to Howard for that, if anything.
All of the relationships and friendships.
Yeah, absolutely.
Yeah, and for a couple years, I did get my teeth cleaned at Howard. One of your classmates was my dentist, so and I'll tell.
Nice.
Gosh, I don't want to. I guess I'll say this part. So for 4 years in residency, I did not go to the dentist. I didn't really know what was going on in my mouth. I just knew like one of the student dentists from Howard had worked on my teeth, so I didn't know what I was working with.
Yeah, I got you.
About a year and a half ago, I finally went to the dentist, and they looked at my mouth, and everything was great. And they're like, "Oh, you had really good dental work done," and it was a relief. So kudos to Howard University College of Dentistry.
There you go. All right. Whew. I can breathe. I thought the story was gonna go another way. So it's good.
I will say, the hygienist, she heard I hadn't been to the dentist in 4 years, and she was like, "Oh my God, I don't know if I have time for this today," which I felt a little insulted.
Oh, really?
Then,
that happened at the school, or?
No.
This is this is at my new job. This is after 4 years.
Oh, okay. All right.
And so she was upset. She told me that I brushed my teeth too hard.
Oh, really?
That was her
Did you
feedback.
have like some gum resection or something?
I mean, I don't know. She was just like, "Oh, do you brush your teeth hard?" I'm like, "Well, yeah, I brush my teeth. Can we focus on that?"
Yeah,
but
that's like the go-to, conversation starter, I guess.
Yeah, she said,
it's always
I
like,
should use a water
you
pick.
brush your teeth too hard, or do you floss? There you go. Or do you floss? That was like the go-to, talking points.
Can't win. So when you come out of dental school, there are a couple of options for fellowships. Can you discuss a couple of those?
After dental school, you can choose to do like a residency or specialize and narrow your practice into a certain field of dentistry. There's different ones. You can be like oral surgeon, which is surgery based, a lot of extractions, like full mouth reconstructions, dealing with trauma. Their programs are more like hospital based, and then you can do something like an endodontist, which specializes in treating root canals and diseases of the nerves of teeth.
There's also orthodontics. That's braces. I know a lot of us have experience with that. Periodontics. That's dealing with the gums, the bones that support your teeth, and sometimes placing implants.
Prosthodontist. That's another complex full mouth reconstruction cases involving like missing teeth, placing implants, dentures, a lot of crowns, bridges.
And then pediatric dentistry, which specializes in working with children, and I have a lot of respect for pediatric dentists.
God bless pediatrics in general.
Yeah.
All pediatrics.
That's true.
Yeah.
Yeah, so a lot of options that are out there.
Yeah, absolutely. And then so those are like specialists, and then as a general dentist, you can still do some of those things that specialists do, but maybe more complex cases you would then send off to the specialist. So although a general dentist will do root canals, very complex root canals, maybe root canals of upper back teeth where they're like multiple rooted teeth with, a lot of curves and stuff, maybe we'll send those to the specialist.
Okay. Yeah, that makes a lot of sense. You both have been in practice for what, going on 6 years?
We actually both did a year of advanced general practice training. So I guess
Yeah, 5-6 years. Yeah.
Yeah, 5 or 6.
5-6 years. Yep.
You've been working in the associate model, but you're planning on making moves into a different type of practice and a different practice model. Can you tell us a little bit about that?
Absolutely. So, as you were saying, we're currently associates, which means that we work for someone else. So we work for a company, and we are transitioning into becoming practice owners, which means that we will own our practice. We'd make all the decisions, both the financial decisions and the clinical decisions, and more importantly, the decisions of where our practice is going and the overall vision for our practice. So we'll basically be a small business owner and work for ourselves.
When did you start that process?
So we started this process last year.
I think it was last September. We hired a consultant.
Yeah. So we started this process last year. The process typically can take anywhere between 12 to 18 months. We're doing a startup, which means that we're building a practice from scratch. So that typically takes a little bit longer, about 12 to 18 months. Whereas if you would buy an existing practice from someone, you can close on a practice a lot quicker, maybe within a few months, maybe like, 3 to 6 months, you can kind of close on the practice and take ownership of that practice.
Geez, so you guys are building one from the ground up. So that involves, I guess, that consultant will help you find a location and or what all do they do?
Yeah, so ground up, and the consultant that we're using, they kind of walk us through everything. We always have final say, and we have 100% control in the direction that it goes. But as I was saying, the first thing we do with the consultant is talk about the vision of our practice, how we want to practice, our ideal patient, where we want to practice. Once we figure that out, then as always, you got to go find the money. So you source funds from different banks. Once you get approved for a loan, then you go ahead and narrow down where you want to practice by getting demographic reports to see if those areas can sustain a new dentist coming to the area. And there's certain ratios that you want to look for provider to patient ratios that show you that the market is not like saturated. Once you find your area where you want to be, then you actually go and look for the space. So you can either lease a space or you can go ahead and purchase the real estate. There's pros and cons to doing it each way. We decided to lease our space, and that's more so because of the inventory that was around, and also you get some help from the landlords in regards to like tenant improvement funds, which helps you to actually build out your space. So that's a big help. Once you find your space, you want to design the floor plan, which is basically how your office will be laid out with different operatories, where your guest lounge will be, where your staff lounge will be, different design features. Do you want TVs in front of the chairs and all that good stuff? Once you have your floor plan, then you go look for equipment. So you decide what type of equipment you want, what type of chairs you want. If you want to do 3D scanning with CT scans, do you want to do digital impressions? And that's like kind of the fun part where you're basically just like shopping. And then once you have all that in place, you actually start to build out your space. So you do construction. So right now we're in the permitting stage, which is right before construction. So we've submitted permits to the county to say we're going to go ahead and build a dental office. These are our architectural drawings. These are MEPs, which are like your mechanical, electrical, and plumbing drawings and designs. And then once those are approved, then we jump into the construction phase. So that's where we are right now. And then after that, it's marketing your practice, which is huge, installing the equipment, and then making sure everything's running well, and hiring your staff, and training your staff, getting systems in place, and then hopefully seeing patients and making some money.
Yeah, and that is incredible, and definitely sounds doable the way you break it down. I mean, when you step back and say, I'm going to own my own dental practice, that's a very formidable task in my mind, but it's incredible that you guys are making it happen and bringing this project to fruition.
Hmm. Yeah, and it's a testament to who we're working with as well, because you can do this on your own, but there's a lot of steps involved. And what we were finding is that if you make a misstep early on, it just kind of snowballs on itself, and you may
Mhm.
not catch the mistake till later on when it's more expensive to fix, or it takes a longer time to kind of come back from that mistake. So we're just trying to minimize the amount of corrections we have to do. But I mean, at the end of the day, when you're a practice owner, a business owner, you're gonna learn a lot, and there's gonna be things that you do maybe a way that you wish you hadn't have done. But as long as you learn from them and know how to pivot and get back on track, I think that's the most important thing. You never fail as long as you don't give up. So
Yeah. And I assume in your current model, you sign a contract or there's an employment contract with your dental group.
Yes. So the contract usually outlines your pay, if you have a restrictive covenant, if and when you decide to leave the company. Usually the contract is renewed annually. And then we also have an annual review just so that management can discuss any concerns they have, areas for improvement. I guess it's kind of like any other job for the most part.
And I'll just add to that. In those contracts, there's actually a non-compete clause. So it basically says you can't open a practice within a certain radius of where you're currently working for them. So that also plays a role in, for a certain amount of time. It's usually like 2 years, I think.
Right. And that's so that you can't poach patients.
Or just you can't compete with them. Not necessarily poach patients, but less competition for them.
If once you mentioned that, I was reading a book recently called Power Moves. It's by Dr. Bonnie Simpson Mason. She does a lot of work educating healthcare professionals on how to work with a contract, because they mentioned that the non-compete could be in relationship to each of those different practice locations that a company has.
Yes, absolutely, it could. So one of the ways you can protect yourself when you're signing a contract is to, number one, obviously cliche, but have a lawyer look at it. But it's true, have a lawyer look at your contract. But there's some verbiage that you can put in there, and some of the verbiage that you can use is something along the lines of, you can't open a practice within X amount of miles from any office where you work on average like more than 2 days a week or something like that,
Gotcha.
or more than 1 day a week. So what that does is it says, just because I'm part of, XY Dental, doesn't mean that I can't open a practice close to any XY Dental. I can't open a practice around the XY Dental that I work at. So there's some verbiage you can put in your contracts to protect yourself, and a lawyer could guide you a little bit better, but there's definitely verbiage that you should have in your contract.
Are you ready to share the name of your new practice?
Oh, absolutely. Go ahead, babe.
So our new practice is called Toothsome Dental. Toothsome is actually a word. It means attractive or appealing. So yeah, it happened to work out because we do want our patients to feel attractive and appealing when they leave, and we want them to be happy, lifelong patients of our practice.
Mm-hmm. Yep. So yeah, that's our practice. We chose that name because we didn't want it tied to a specific geographic region, because like Maryland Dental, just say, or something like that, or a city. We didn't want it to only make sense in a certain area. And this goes back to vision, looking down the road, for if and when we decide to expand or grow, we'll have a name and a brand that can transcend borders. So that's the reason behind a name like that.
Yeah. So tell us, what area will you be working? What type of patients are you looking for, and what are you going to offer these patients?
So we're going to continue working in Southern Maryland. Right now, we're focusing on Charles County in Waldorf. Patients we're looking for are young professionals, families, patients that are interested in replacing teeth, pretty much patients that are motivated and they're concerned about their dental health. We want to build a rapport. We want patients to feel like they're active members of our dental family. We want to be active in the community surrounding our practice. We kind of want to be a pillar in the community and find ways to give back. We also want, to mentor and help other people that look like us so that, just like my experience, they feel like this is a goal that is attainable.
And how long have you been in that community?
So we practice in Southern Maryland right now. Dominic has been at the company that we work for 5 years. I've been there for 3.5.
Perfect. So you've already invested into that group, and you're going to invest further as you open your own practice and can tune in and focus that care.
Yep, absolutely. We had the opportunity to buy into the practice we're working at right now. We were close, but we just did some soul searching and really thought about where we wanted our careers to go, and we decided to bet on ourselves.
I love it. I'm betting on you guys too. When can people expect to see you open and come in and start receiving care from you?
We're hoping to have our office up and running late October, early November of this year.
Incredible. Well, guys, definitely keep an eye out for Toothsome Dental. Did I say it right?
Yep, absolutely. Yep,
Yeah, you
Toothsome
said
Dental.
it right.
And we're on Facebook now.
Instagram.
And Instagram at Toothsome Dental.
And Twitter.
All the social medias. And our website is toothsomedental.com. And we should have a temporary website up pretty soon because we're entering our marketing phase right now. So
we'll definitely keep an eye out for that. So Doctors Chapman, what would you tell kids that are interested in dentistry, or anybody for that matter that's interested?
If you are interested in dentistry, whether you have a dentist that you see regularly or you just want to get more information, I know there are a lot of dentists that are open to mentoring. The whole each one teach one is really big, and a lot of people go far in our field just because they have that support. If you're interested in shadowing, I know there are a lot of dentists. All you have to do is ask, and they're more than willing to have you come in.
Yep, absolutely. We appreciate this platform. Thank you for having us on. We'll definitely be following along with your podcast and your journey as well, because it is inspirational.
All right. Well, Dr. Shannon and Dominic Chapman, thank you so much for coming on the Black Doctors podcast and sharing with us what it's like to be a dentist and to be an entrepreneur and practice owner. Before you go, tell us one more time the name of your practice and where we can find you.
Toothsome Dental in Waldorf, Maryland. Thank you again for having us, and stay safe.
Yep. Thank you. Stay safe, everyone. Appreciate it, Stephen.
Thanks. We'll catch you next time.
The Black Doctors Podcast is a nonprofit, volunteer passion project with the goal of inspiring all who listen. Tune in next week for another episode of the Black Doctors Podcast with Dr. Stephen Bradley, your friendly neighborhood anesthesiologist.